Hi, thank you for joining us at our 18th year anniversary, and we could not do it without you. And Linda and I, because everybody who knows Allenby Dermatology knows Linda Moore with me. And if you don't know who I am, I'm Dr. Janet Allenby, which you should know me if you're on this. So anyway, first of all, I want to say thank you so much for joining us in this virtual meeting webinar. It is always our pleasure to have a party. And I promise if we keep up with the lack of pandemic that's going on, next year we're really going to have it in the office and everybody comes in and we're going to have a huge party in here for all of you people. And you guys know I love you. So we have some great things tonight. And Linda's going to first kick off. And again, Linda has been with me the full 18 years that I have been at Allenby Cosmetic Dermatology. I am sadly was in practice another 10 years before them, so I am old, but you know, we're
not as old as I am.
There you go. I got to look at the positives, right? So we're going to talk about some really cool things that are going on in here. And, you know, I think it's funny because one of the big things that happens here is I kind of get new machines and new devices or new products or new injectables because I'm always falling apart. And as I age, I think, or all of us age together collectively as a team, we see the needs that start happening. And so we have some really cool things that we've investigated, and here are some great things. First of all, we're going to do some really good giveaways, and these are for some, we're going to draw names, and first, by the end of this program, we're going to have a bunch of names, and we're going to draw them out. It's going to be later this week, and we'll announce who wins, but we have some really good giveaways that Linda's going to talk about. And then for everybody that came, we do have to celebrate our 18th year here. And, you know, it has been fantastic. Even with the pandemic, I got to say, it has been fantastic even the last 3 years in our new office versus our older office, celebrating every single day with everybody and really enjoying the journey that we all get to have together.
And as everyone knows, I am Linda, and I want to make sure that everyone knows we have terrific giveaways tonight. They're for 5 special people who are attending for this evening. So I'm going to announce some of the terrific giveaways. One is a package of 4 cool peels on the face with Amanda, valued at over $3,000. I also have a package of 3 Morpheus V, which if not everyone knows what that is, please call in and we'll explain it.
We're going to talk about it tonight, I promise you. So we're going to go through all of these and why you guys want to have these giveaways.
There's a package of 4 V-Tone treatments, which is actually, again, valued over $3,000. We have the Lift V at home treatment for everyone, which is worth $600, and a Lift Pro Mass treatment valued at over $300.
Yes, so these are the giveaways that we're going to draw for. And I will tell you, these are great, and you're going to understand why these are great by the time we're done tonight, because we're going to talk about each thing. And all of these are new to the office, fairly new, but things that are going to help us feel better about ourselves, look better, kind of be the women. And you know, this is really kind of a woman's program tonight, I got to tell you. And since we have a lot of women in the practice, and if there's any guys watching, sometimes you got to help your woman get there too. So this is good information, and you're going to enjoy understanding why we're doing what we're doing. Now we do have some offers for our 18th year anniversary,
which is going to go over $180 off of any package of 3,000 or more. And this can be applied with Dr. Allenby, Christina, or any non-provider service.
So basically anything in the office. If you're spending on a package of $3,000, you're going to get $118 off, which is our 18. So congratulations. We're happy to offer that for you. And we also
then, of course, for products, which I love, we're giving it through the end of the month, 18% off, of course, for 18 on all products for the week of March 14th through the 18th. So please, everyone, call in because we have terrific products here, like you all know. So I want to please call in starting tonight, tomorrow.
Tomorrow.
It's not tonight. We're going home soon.
No, but you know, I do want to really express again my gratitude to every single person out there who's joining us. I mean, it means so much to me that one, you guys are all there with me and on this journey. And again, you know, the journey is that we're all kind of falling apart together, and we're trying to stay together as a group. You know, it's not an
Absolutely.
easy, this aging business is not easy, as everybody can understand. And there are different struggles at different ages. And we have, you know, we have patients from the 20s all the way up to close to 100 years old. And, you know, it's like, wow, that's
True.
pretty amazing that they're still caring, and, you know, people haven't given up yet. So I think, you know, it really is a testimonial to everybody wants to feel good. And by looking good, they do feel good. There are other things that we're going to talk about tonight, and there's going to be a little sensitive material in here, and we're going to let you know what it is. And it's about women's health. And I got to tell you, since the hormones kind of took a nosedive, we all know about that stuff. You know, it does affect a lot of things in our female world, and I'm not going to go to it now, because when we have it, if you don't find it appropriate for yourself, then you can just turn it off, and then we'll let you know when we're coming back on for other stuff. But it really is something that I found out. You know, we all kind of find out these things, and it doesn't have to be just menopause. It's somebody who might be perimenopausal, or somebody who's had babies. So it affects all of us, and it's just, you know, anything we can do to help you feel better. Now, a lot of what we're going to talk about tonight is, we all know I love filling. You know, I have been a thread lifter, Sculptra, you know, threads, and I think neurotoxins like the Botox, the Dysport, for years, and they are wonderful devices. But I think what happened in the last year or two, actually kind of like it kicked off right when the beginning of the pandemic, is all of a sudden we had devices that tighten. And if you didn't go get a facelift, you had to start tightening, because a lot of people are looking in these cameras. I'm looking at myself right now like, oh, you know, I want to throw up when I'm looking at myself. But that's just our normal inclination, and what we kind of mentally do to ourselves. You know, you're like, oh, but she looks good. In our own mind, we're never nice to ourselves. But one of the big things that really happened this last year is a lot of people either opted for surgery, which sometimes you have to do it. The other thing is, really, we've come across devices, and there really have been developing devices that are very tissue tightening and minimal downtime. And I think for our office, we're really a non-surgical office, is what can we do that doesn't keep you out of the loop of life? And now that we're getting out of pandemic, this is even more important. Now, I will also say, you know, I think we've both seen a lot of our patients went and had facelifts, and wow, they look fantastic for about a year. And they're already coming into their second year of aftermath of the facelift. And we're kind of seeing some funky looking stuff coming up. And I won't say that it was the facelift. You know, we have to get rid of extra skin either by tightening it or excising it. So it's not anybody's fault. It's just whenever you have surgery, sometimes you're going to have an aftermath of some different shapes. And when we look at shapes, you know, and anybody who's talked to me at any length of time, they know I'm about the whole outlook, or outcome, I should say. So if somebody's shape is kind of modified, or it just doesn't fit right, it's usually, you know, something got changed up on them a little. Maybe the jawline looks a little bit not so squared off. It looks more like a straight line going down. That looks age. So sometimes they get a facelift and the jawline is still too straight, or too, you know, doesn't have that nice square 45-degree angle. And myself, my PA, my nurse practitioner, we're going to add a little jawline to give a younger look, because there's shapes that imply youthfulness. There are shapes that we know automatically are older. You know, I was talking to New Beauty today, and they were saying what things have changed. And it really, we've gone from just filling in little wrinkles to actually reshaping faces, tightening them up, doing things that really don't have downtime. And that is the whole key to what I do every day. Is I don't want to have downtime. I know you don't want to have downtime. Now that we're out of the pandemic, nobody wants to be stuck at home anymore. So you want to be able to get out there and not have, you know, crusty stuff and all the icky things that happen when you have big surgeries, or even CO2s. So the first thing we're going to talk about is actually one of our newer devices. It is a CO2 machine, and I've been doing CO2 since 1997, and it has a huge evolution over time. And when you hear the word CO2, you think, oh my gosh, is that the one that takes your face off and you look just, you know, like hamburger meat? It was back in the day. Now, 20 plus years later, it's been modified so well that we can have great results with very minimal downtime. I'm going to demonstrate with my nurse practitioner, Amanda, and I'm going to introduce you to Amanda because she's new to our office. And we're going to do a cool peel, and it's a CO2 laser that the way that the light is put onto the tissue, it's different than it used to be. So it's actually a deeper result. The result's actually deeper, but the downtime is lesser. You look like you had a little irritation or like a sunburn at the most for a day or two. Now, there are some people that will start off with a little more aggressive treatment because they just have more on an aggressive treatment. But for those people who really want no downtime, this is something that's going to start smoothing out the color, smoothing out the texture, those finer wrinkles, those little crepey things that you see. That's what it's really going to do. So we have giveaways that we're going to be drawing for, and it is going to be from everybody who's joined us tonight. And thank you so much for taking the time out tonight and celebrating our 18th year anniversary. I just so appreciate it. And then the offers that we're having for everybody who's joined us, you're going to have 18% off products. And you guys know that my philosophy is, if you're not supporting the procedures with products, or you're not supporting a plastic surgery event like a facelift with products, you're doing yourself a disservice, because all of these things that we do are pretty expensive at the end of the day, but you can support it with products and not have to necessarily do them so often, and you keep that look better. So it's really important to be very, consistency is the key to everything, whether it's just healthiness, or it's keeping up with your looks, or it's keeping up with your body. So these things all kind of gel together. Products 18% off, $180 off any $3,000 package with basically anything in the office. So that's for everybody who's joined us, and I so appreciate you guys coming in. So you're getting close to 20% off, which kind of never happens in my office, so take advantage of it. So we're going to go over to the Cool Peel room, and we're going to introduce you to our new nurse practitioner, and we're going to do a little Cool Peel on my mom. All right, come on. Oh, we're going to do a little before and afters in the meantime. So then you Okay, so we have some Cool Peel happening here, and what we're going to show you is actually, first of all, this is my mom. She's the product of why we're here tonight for me. So say hi, Mom. Like, hi. Okay, everybody's got to take advantage when all the good things come along here. So this is our CO2 machine, and we're going to see Amanda here. This is Amanda Rose. She's a nurse practitioner that's joined us, and she has been doing our Cool Peel, and she's done lots of people at this point already. The entire staff's pretty much gotten done, and I'm kind of hiding between this handpiece here. So we're going to go ahead and show you what it looks like. So first, before I even tell you this, you see something gooey on the skin. So what we did is we had some topical numbing put on it. Honestly, this one you barely need numbing for, but this is my mom, and I got to make sure the mom is taken care of, because I'll hear about it later if I don't. So she's like, yep. So what we're going to do is, at home, you can use a topical numbing, or you can come in. I actually would just have you do it at home. And I love, 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 there's a mask that I'm going to show you. They've already peeled off the upper half. And I'm going to just peel a little bit of this off so it looks like a little kind of a peach colored gel. This is a CO2 lift, and this is actually a carboxyl gel that increases the blood flow, but it really hydrates the skin. So we put it on top of the numbing, and what's going to happen is it's going to hydrate the skin. Now, CO2 is a laser, and all lasers are looking for something. When we hit the foot pedal or the button on the side, when you hear a noise, it's putting a wavelength of light. That little Mickey there. So what happens is the wavelength of light is looking for something. And in this case, CO2 is actually looking for water. So the more hydrated somebody is, meaning you drink your water, also works for radio frequency too. The more hydrated you are, the better the result, and actually the less painful the result. So you drink a lot of water before your treatment, but you seal the numbing and you seal the skin in with a hydrating mask, and it will have a much better outcome. It heals faster, it hurts less, And in those of us who've had Morpheus, and I will talk about Morpheus in a minute for the face, we know it's a little more uncomfortable, and it's a great tightening device, but the uncomfortableness is there. When you put the mask on top and it really hydrates, you're gonna have a better penetration of the laser light and also the radio frequency because it's looking for water. That's what the device is kind of geared for. Like if I'm doing color only and I'm using one of my other machines like IPL, it's looking for pigment and it's not going to look for any water. It's not going to have any other problem or any other direction that it's going to. Now, let's see. Actually, Mom, just lift your head for 1 second. I don't know if you can see, she's a little bit pink here. This is the treatment, and this is it. And this is the most she's going to be red. And she's going to be red for probably about maybe a day and a half, and it looks like a bad sunburn. And she does water aerobics, so she's probably getting a bad sunburn out there anyway. So people really won't notice that she's doing it. And by tomorrow, she's going to be putting her sunscreen on and doing most of her normal activities. So what this device has done that's different, and I don't know if we can actually capture it on the skin, but I will show you a little trick here. Okay. This is an impromptu thing, so if it doesn't work, sorry, but we're going to try it anyway. So what's going to happen is I'm going to show you what it looks like to laser something, and I can use it on this tongue blade here. Okay, so what I'm doing, as you can see, if it's hitting the tissue, and I'm just shrinking it to the size of this, it's, let me see, oh, I think I turned myself off. Let me get you back on here. Here we go. Okay, so it's reloading. So anyway, the difference is with this, it's called a scatter, it's a scatter the pattern of what it's putting on the skin. If it's good, hit the other button for me. There we go, thanks. This little orange light has to be on to be working. Anyway, so I shrunk it down. So the scatter light is different in that, and I'm not going to show you that one, but this will be quick, so I don't want to waste your time too much here. But what it does, and I'm going to show you here, okay, this is, maybe you can see this. I don't know if I can capture this for you. Let me see. Okay, so could you guys, I don't know, my staff, if you guys can see that. So what it's doing, and you can barely even see like a burn here, but she's very red here already, so it's definitely working. The scatter makes it kind of hit in all these random little hits of burning of the tissue. And what that does versus the older machines is you'd hear the noise and you'd hear like zzz, and it was almost like one of those laser printers, this zzz, back and forth, and you actually see square marks. This does not give you the square mark, but it hits it more randomly, so it looks more natural. And sometimes when people have laser, they see the kind of the handprint look all over the skin, and it's going to actually, it hits in the columns only where it burns, and so the little burns are all over the place, but really scattered. It's a better look at the end of the day, and it's less damaging. The more that you're spread out with your little burns, the tissue between lets you heal faster. So we're going to keep doing my mom. She's probably like, okay, I'm ready to get going here. She's been numbing for like about an hour and a half because she's ready for this to go on. So we're going to go ahead and talk about something else now. But Amanda, thank you. And Amanda has been having fun doing this. We'll go ahead and go back to the normal size again. So we can actually do this, just so you know, in probably about 15 minutes, we can do the whole face. And that's one of the great things about these devices is that we do it pretty aggressively around the eyes, pretty aggressively around the mouth. These are particularly good for the, I'm sorry, I keep getting behind this thing. These are really good for the little smoker lines, which we know nobody smokes anymore, but everybody hates those little lines. The area around the eyes is actually to lift the eye more. So when we laser around the eyes, it's actually kind of giving the eye a lift. So that is why we're pretty aggressive around eyes, we're pretty aggressive around lips, and you really still don't have that downtime, which is great. So that is why we like this, is because not only does the whole skin get a new skin to it, it's going to tighten, and it's going to tighten all that area around the mouth where you get all that kind of fine, like real crepey looking skin. So you have fun. Right. Amanda, thank you for joining us in the practice thank too.
For having you.
We're going to go to the sensitive area, which is women's health next. Well, okay. So my mom is getting tortured in the other room. So, okay. So whoever has not met Christina, she's our PA, physician's assistant, and she's been with me for several years now. And so a lot of you got to meet her and know how great she is. And on top of it, it's her birthday.
Yes.
So happy birthday. She is all of 21 again. I don't know how it happens, but you know.
Great skincare and
Yes.
lasers.
Yes, exactly, exactly. So we're going to talk about some women's health things. And like I said before, I'm aging and I didn't really have issues before. I've had no children. Life was good. And whammy, all of a sudden I lost a lot of hormones. And it's funny because I just did some more hormones yesterday and it was like a week ago. And it was like, everything's like pinned down to the 0 level. And I'm like, oh my gosh, okay, maybe this is why I can't remember anybody's name ever. You know, maybe this is what's going on with me. But it is, you know, this is just part of being in your 50s, is that we really lose a lot of our hormones. And, you know, thank goodness I have somebody in her 30s who can actually, you know, kind of step me back and to get out of this menopausal, perimenopausal mindset, because there are needs when you're younger also.
Definitely.
And we don't do the hormone therapy here. Just so everybody knows, I definitely have hormone therapy getting done because it's so necessary in my world. But it is something that I think it's something everybody should explore, and you make your own decisions whether it's good or not for you. But we do things that are going to make women's health more healthy. I think is good to say it that way.
More educational.
Yeah.
Not so taboo to speak about, and really a really easy couple of treatment options. So if you guys do not know this, I just had a baby almost 1 year ago.
Her first baby.
My first. And I actually, during my pregnancy and after, a lot of women may or may not attest to this, developed some stress incontinence. And you know.
Okay, so for those very few people who don't know what that means, if you're a woman, go jump on a trampoline,
Yes.
you know, and you'll know what it means. It means you like pee your pants. You
Right.
sneeze
so
and you pee.
You sneeze and you
happens.
pee, you cough and you pee, you have to cross your legs. It's like,
Yeah,
you know,
you giggle
when
and you sneeze,
right.
and
And
you know, it's always when you have a little alcohol in you too, which
Yes.
is even worse.
And so, you know, I used to actually, before being in derm, for a very short period of time, I worked in OBGYN. And to your point, you know, as time goes on, it's not just a perimenopause or postmenopause issue when you lose estrogen or bladder relaxes and all that stuff happens, you know, with the incontinence. But even after having a baby, after having, you know, going through multiple pregnancies or even just one pregnancy, it's common. So I know there may or may not be some people out there that have looked into this, and the only option was really surgical treatments.
Right. Oh, yeah.
And who wants to deal with that?
Especially in her 30s.
Yeah, especially in your 30s. It's just not something that, you know, is even really spoken about. And then when we got this new machine that we're going to speak about, I really was interested. And I feel like it's something that I think a lot of women need to know about, you know, whether it's at an age group where, you know, hormones are changing, or if it's after a pregnancy. It's an option for anybody, really. It doesn't have to be, you know, in your 50s or your 60s. It is for somebody my age, and I'm in my 30s. So,
right. I mean, you know, I think, you know, like she's had a baby. I've had no children, and that's why my things sort of come out later.
Yeah.
But it is really, you know, I have to have the understanding of why something's happening to understand why do I need to buy a machine instead of another car, okay? Because that's the same price. And, you know, there's got to be a reason why I'm going to do what I'm going to do. Why am I going to buy a machine that's going to perform something for us? And what's going on with the bodies, whether it's because of actually physical pressure of having a baby, and I'm going like this because this is what happens, and the baby comes out. But what happens is the pelvic floor, and there's a lot of women who have pelvic floor disorders. And I mean, it's crippling. I have a lot of patients I've talked to, and it's actually just horrific what goes on. And the pelvis is kind of like a little basket like this. And there's things that go between the little basket threads there. And so when your basket starts losing its strength, it goes down. So one, what happens is between hormones, and more my case, or in physical, you know, something going through, the pressure that it's pushing through there, it changes the tissue. And And as you're older, it's the lack of support because of the hormones have changed, and you just don't have any like thickness of the tissue anymore. That's why we get all skinny, thin. Like she's gonna have nice spongy skin still because she's younger. So you have less support with skin, and then you have less support with muscles. So the machine that we're talking about is something we've been using in the office. We've been doing like vaginal we had Thermiva. Now we have something called Formavi, which is a Morpheus device, and I will keep talking about this for a second here. So we've had it for probably about 5 years, and I gotta say, this is such a taboo area to talk about. I mean, I'm even a little embarrassed to talk about it with patients, and it's kind of a hard discussion to even like, how do you even start talking about it? If you're starting to have painful sex, if you feel like you have sandpaper when you're having sex in there, that's some of the things that these devices help. If you are jogging, and mine is always like I'm jogging down Las Olas and I feel like I'm peeing my pants half the way through. I just had to stop jogging for that one.
That's how I.
Yeah, and pregnancy does that to you also, which I didn't know because I never had that. So what we did is we've been investigating different machines, and it's very interesting. The people that get treated are just beyond happy because it is something that rejuvenates the tissue.
Yes.
Just like we want to rejuvenate here with devices, we can do it down here. You can make the outside tighter. You can make the inside have better tissue. Sometimes you get looser. Sometimes you just have no moisture in there. And these devices help you with all these problems.
Mm-hmm.
So we've been using something called Formavi, and InMode is actually the whole brand that has Morpheus. And we use a lot of these energy devices. So Morpheus is a new treatment that we have, and it's called Morpheus V. And it's actually the same Morpheus we do on the face, which is with those little micro needles. We actually can put it into the vaginal canal and tighten up with that internally, which is a much stronger device than the procedures that we've been having before, which is called Formavi, which is more like a wand that has radio frequency. It's kind of like one of my machines that you do just external radio frequency on, or sometimes we use it anywhere in the body. Mm-hmm. And then there was a new one, and this is actually kind of the one Christina's like really been like wowed about, is something called V-Tone, which you can explain a little more.
So V-Tone is just a great way to kind of re-strengthen the pelvic floor muscles. It's great for somebody that has that stress incontinence, like we were talking about. If you sneeze, you cough, and you kind of feel like you have to use the bathroom, or in my case, I would have to stand there and kind of like cross my legs and squeeze and pray that I didn't feel like I peed myself. And I mean, imagine, I'm sure a lot of people go through this, you're at the mall, you're with your friends, you're out to dinner, and
you're gonna go like right there.
Yeah, right. You have to like break that in there.
There's no warning.
And I had a little bit of it before I had my son, but then definitely after I had him, it was significantly worse. And it's a really simple treatment. I actually did it I do it after office hours. It's about a half-hour treatment. Mm-hmm. And it's on this machine that we have over here.
You can't really
see it.
This is one of the hip pieces, but it's not the one.
It's not the one, but basically what it does is it contracts the pelvic floor muscle. So it basically is doing so many Kegel exercises for you. And what's funny,
so it's like half an hour of
right,
Kegels.
half an hour. But what's funny, and I'm going to be a little like TMI right now, is that I've never done a Kegel before because my pelvic floor muscles are so weak. And you know how I know that? Number one, I've never been able to do it. But when I did this machine, the intensity, I couldn't go very high on it for the first one. And that's really why I bring it up, is because you don't realize. And I think that you don't have to go through surgery. A lot of people may be thinking, well, why would I go to a cosmetic dermatology practice to have this done? Because, maybe the GYN offices are too busy, or they don't have this, or they'll send you to physical therapy. They told me to go to a pelvic floor therapist. And that may be something that somebody would want to entertain prior to doing this, but it's a very easy, non-invasive treatment that's really quick.
Actually the fastest growing area, because there's, particularly all the boomers are and all the younger people in your age group actually will go do something and we'll talk about it. Like when I was in my 30s, this would not be a discussion. Right. I would have like hid under the bed and said, nobody's going to find out this is happening. But times are changing, and thank God they are, because it should not be such a taboo discussion.
And it's just I definitely was not interested in having surgery. I was not looking into that. And honestly, before I would even consider that, I would be looking for a non-invasive device. So I'm really happy that we have this. And I think a lot of our patients and people that are watching, and maybe you have, somebody that you know in your life that talks about this, or maybe it's you, it's a very quick, painless procedure. We do it in the office. It's 30 minutes. It's a series of treatments that you do once a week. It's something that you can do like on your lunch.
Right, and you might want to continue with doing them. Honestly, it's kind of like, it depends on how bad shape you are.
Mm-hmm.
If you're in great shape, maybe you do a package of 4 or 6, and then you do it again in 9 months to a year.
Right.
And it's the same as, and it's kind of the reason we kind of got into one is because I was having these issues, but 2, because it's the same devices that we're using on the face and we're using on the chest.
Mm-hmm.
We use the Morpheus for the body to tighten up all the skin on the Laffy Taffies on the arms, on the thighs. So all these things are they're kind of like already happening in the office anyway.
Mm-hmm.
I will say, I think we get more positive from the husbands. And I do have a lot of patients who are, it's improved their sex life. Let's just get to the bottom line. It improved their sex life, and the husbands were so grateful that the woman was wanting to have sex with them and that they were enjoying it again. Because a guy does not want to have sex with you if you're not enjoying it at the end of the day. It becomes, it's not a good thing. They want you to enjoy it. But, sometimes just because the body changes, whether pregnancy or you feel uncomfortable because of pregnancy. So like, even if you feel like things got too loose, even externally, we can use not necessarily the one that you're on with the V-tone, but we can use the radio frequency to tighten up the tissue around there. And things look really good. I mean, I've never seen so much of this area before in my life because I've never been doing OBGYN. But wow, when I'm seeing these before and afters, it is pretty remarkable. But more importantly, we have people that are super happy. Now, just like the peel that we had on my mom that kind of sealed in the numbing cream and actually made the treatment better, we can actually use also, that's kind of where we found the topical cream for the gel for the face, it was coming to us. It's called V-Lift, or the Liffy, I'm sorry. And it's that carboxyl gel that you put on the face or the neck or wherever we're going to treat to hydrate the skin and have a better response. We actually have it for the vaginal area too, and I'm kind of pointing down there. That's kind of V-shaped, huh? Anyway, but really, you can, like, the company, and we haven't been brave enough because I'm kind of like attached to my devices. The company does claim that you can do 6 of these treatments and almost like you're having some of these treatments. I like treatments, so I'm very quick I need to see some quick results if I'm going to be doing something. So you can marry it with the package and use it internally, and it does all those things. It hydrates the tissue, and that's one of the biggest things is you just lose a lot of the structure and hydration as we age, but also after a baby, this happens too.
It comes in this really nice kit. It's 5 days worth. You mix here it is actually. It's right here. See, really nice box. And when you open it up, it has this little spatula and it has 5 days worth. You mix these 2 packets together, and you basically, what you do is you insert it inside the vaginal canal, and it's great for like natural lubrication, hydration on the outside tissue. When I used to practice for about 8 months, we were talking about it doing OBGYN, and one of the complaints that a lot of women or postmenopausal would say is that they were very dry.
Yeah.
And those creams like estrogen, creams, estrase, like after a while, some people would complain they weren't happy with them. Why were they using them? Because, like you said, it was dry, it was irritating.
Right, and you don't use estrogen that way. That's not the proper way to be getting an estrogen dosage. Because
it's just very localized.
Right, exactly. And it does, you're 100% right. This is a whole different.
So it's great, like we were saying, to kind of pair it together with these treatments. And I think that we're really fortunate that we have these. We're fortunate that there's something that our patients can learn about and that they can use. And it's a quick at-home treatment, and
and we can actually talk about these things. So I think we're kind of doing some question and answers now. So if you guys have any questions, please ask. And I have Bridget who's going to be relaying the questions to me. So
the first question is about the pool peel.
okay.
Would you tell us what Fitzpatrick skin type the procedure is appropriate for?
Guess what? It can be done on any skin type, which is the first CO2 that can ever do that.
That's a great question.
That is a huge one. Okay, so the question, if you didn't hear what Bridget was asking, is what color skin types can this pool peel be done on? And in the past, we could really only use it on pretty light complected people. So I would be the darkest you'd want to go with. Christina would not even be eligible for the device. So today, because of the way that scatter was shown, I was trying to demonstrate the scatter, and the way that the mechanics of the laser is you can actually use it on somebody very dark. We've actually used it on some of our employees that are darker complected, and this is the first thing they've ever had that we can actually use and they don't get discolored. And that's always been the problem, is when you heat up tissue, you're worried about causing a post hyperpigmentation, inflammatory discoloration, and you don't see it with this. There's such little inflammatory response with this, it just doesn't get there. So yay, first one out there. This is actually the first one on the market.
And how does the CO2 machine differ from when you get a CO2 done during a facelift surgery?
Huge difference. The CO2 device, I have that CO2 device also, and actually the device that you saw, I can do that to you also. So the question was, how is the CO2 different than what you get when you're getting a facelift? When you're getting a facelift and you're out with anesthesia, a lot of times the doctors will say, let's just clean the surface, and it's very common to have a very aggressive CO2 laser. It's the kind of laser I started doing back in 1997, which, wow, all the sun damages the slate is cleaned off, but I think people have a harder time healing from that part of a facelift procedure than actually the surgical facelift where they excise the tissue and suture you up. So I will tell you, it was always hard. Somebody had to kind of push me to want to do that procedure in the office. And I actually have 2 CO2 machines. And that's the first generation that I had that was more that type of laser. And it was tough on people. I just had such a hard time knocking them out of the loop for, such a long time. And usually the results probably last about, they kind of forever to some degree, but really, I would say you're kind of looking at doing another in anywhere from 2 to 3 years later, that type of laser now. So if you can do 3 or 4 of these without any, do we have a battery for this? Plug in. I'm about to lose my battery. I don't want to lose everybody. If you can do 2 or 3 of these and have 0 downtime, and then you do it maybe once a year, it depends on how bad your skin is. If you're in really bad shape, you're going to need to do more than 3 or 4. You may have to do 6 of them, but they aren't so complicated. They aren't so hard on you. But you end up getting the result of if you had a really strong one. Yeah. So that's kind of the difference. This is not a face-off event. This is I'm a little inconvenienced for about 24 hours with a little peak, and that's about it. Yeah. We're plugging in here, so
we don't lose you.
Yeah, you might lose us if we go off. It's they're just whatever. Anyway, so let's keep going. We have another question.
How many pool peel treatments are required?
Pool treatment.
We said
we're moving all over the place. We normally do 3 of them. Three is normal. 3 is normal for somebody who's in decent condition. If you really are aged, you're gonna have to probably, like I said, do anywhere from 4 to 6. Now, one of the cool things that I kind of started doing too, you guys know I have a very light peel. It's a TCA peel that is really nice, and what it does is it's also a no downtime peel. I'm kind of interlacing those two, so you don't have downtime, but the skin gets better a lot quicker.
I love that.
Yeah, it's a fun one. Actually, we're probably gonna have some specials on that coming up. Wink, wink. So we'll end up we're having some technical difficulties back here. We're trying to plug the computer in. So if you see things fly in every direction, we don't want to lose you. So anyway, I would say for most people, I would say if you're kind of planning on doing 3, if you have pretty bad shape, maybe we have to do a little more. This is a great CO2 laser for people who we can't really fill them around the mouth, or they're really sagging on the eyebrow. It is a way to not have to fill, because we all know if you get too much filling, you end up kind of getting that monkey lip. Yeah, and that looks kind of weird. Thank you. So I think, this is a new way of going about it. Now we all know, we can't just do threads. We can't just do filler. We can't just do Botox. We have to use a little of this. It's kind of like in your nice spaghetti sauce. You can't just use tomatoes. You got to put a little garlic and a little olive oil and a little this and a little that, a pinch of that. And that's how you really make things look good. And
I always tell, I'm sorry, not to interrupt.
That's
I always
okay.
say
I can talk for
to my patients when they come in and they have a lot of those static lines around the mouth and they have the deep lines around the eyes and they complain about that and there's only so much filler you can do.
Yeah.
And I love the fact that there's very little downtime. Anywhere between 3 to 4 sessions is appropriate. I usually say spaced out about 4 or 5 weeks apart.
Yeah. I mean, if you go away for 2 months, you go,
it's
that's
okay.
fine. This is not a big deal.
But I love this laser. I love
Yeah.
it for pigmentation. I love it for lines.
Definitely for the melasma patients, this is a
Melasma.
great one. And that's why the Fitzpatrick 4, which means a little bit darker complected, are going to do this. Really helps that after pregnancy discoloration.
Yeah, and so this is by far probably the best laser for pigmentation,
Surface.
Yeah. It's a great workhorse. You do a lot for just the treatment that you have it.
Exactly.
Are there different intensity levels?
Are there different intensity levels of the pupil? Absolutely. And it's just a discussion of how aggressive you want us to get. If you're in a pretty bad shape and you want to go faster, you just turn it up a little and you have an extra couple days of downtime. But the downtime is not horrible. No. It really isn't. So I mean, I can get as aggressive as they do when you have your facelift too. And as Christina, she can also do this one. But it really, I think for most people, if we can kind of keep it where it's just not so devastating, and we don't want to have you have to wrap your life around a facial treatment. We want you to be able to go have fun with your face and your life and not have to be worried about this all the time.
And how soon can you do the peel after Morpheus 8?
Oh my gosh, like the next week. I honestly, I'm doing them together, just so you know. So if you're numb already, okay. So the Morpheus 8 is a procedure. We have Morpheus and we have Virtue for the face. Morpheus 8 is a treatment with more microneedles on the tissue and the delivering heat at different levels. And I love this. It is a different procedure, and it really is more to get the lift back up. It's not like with the CO2 is more taking the surface down. So the Morpheus you think is like the lifter. Like if you're getting a facelift, it's the lifter. The taking the surface and just kind of making a new slate is really more the peel or the CO2. So we use them together, and you can actually do them in the exact same day. It's just depends on how much downtime you want. You may have a drop more downtime, but it's still not bad. It's a pretty simple procedure.
A lot of people ask that, and I personally think that if you have the time, like in the office, if you can spend time with us, especially if you need to take off from work or something. But this procedure, this laser, the CO2 is so, the results are amazing with such little downtime that I would definitely pair it with. I think it's a really great option. I've been seeing a lot of people, a lot of providers that are using this machine like outside of Florida, people that I know that have this machine up in New York, pairing it with Morpheus. So doing it. So
definitely.
I like that combo actually.
I know. Well, honestly, here's what happened, and I'll give you a little secret. Is 1997 is like kind of go back to that because that machine, it was called an ultra pulse, and what it was a really aggressive CO2 laser. These were the ones that kind of gave the bad reputation of face off, scarring, all the bad stuff. But what happened is the newer generations of the machines just do not give that deep tightening that the new that the old ones did. So that's why we have to kind of add some sort of tightening. That's where we kind of have to pair it with 2 different treatments. People would end up scarring from the old device. That's why it has such a scary rap to it. So we definitely had to eliminate something like that just because it was too high risk.
Right.
And doing this is a much easier way and it's healthier for the skin, really.
And how much is the pool peel?
Pool peels run, if you're doing a single, which nobody should do single, is $1,000. So we do packages are free, tend to run, I think they're $28.50, I'm pretty sure. I never know the prices, and it's in that ballpark.
Don't forget about your neck.
Oh, okay,
chest.
honestly, we got to do the neck, oh, she's giving me the prices here. $28.50 for 3, so you save $50. If you do face and neck, it's $1,500 for three, no, for one, $38.50 for three, so you save $650 if you do face and neck together. Everybody needs to do your neck. I mean, this creepy skin right here is like, oh, it's a nemesis of our life. And you got to do the chest also because you have to marry this whole thing. I mean, look at this beautiful outfit she has on. You know, if we want to show off our face and our neck together, you have to do from here to here if you want to look good at the end of the day. And, you know, a lot of people kind of just do their face, but then you look at the neck and it's not matching.
Nowhere else.
Huh. Oh, the hands, maybe the arms.
Well, because look how we're sitting here
Yeah,
right now.
all over the
We're
place.
talking, right? If you're going out, you're out to dinner, or you just are looking to kind of get rid of that creepy skin and whatever the case may be, I think that you owe it to yourself to at least do your face and neck. Don't skimp out on the neck.
No,
They go
Yeah,
together.
the neck, you have to.
Same thing with your chest. We
Yeah.
live in South Florida, and we are so lucky
always-
that we
I mean,
can wear
Like,
shorts.
look
through
at
this.
these outfits and
Yeah.
people are wearing them all the way to their belly button.
And then we, you know, your hands. I always remember like when I was learning about aesthetics, don't forget about your hands because you can treat all of this, but your hands still show your
Yeah, yeah.
So
You know,
you gotta
anything
do
you put
your
on your
hands.
face, neck, hands, chest.
And the hands
do
are
it all
so
together.
easy. It's
I know.
like 5 minutes.
It is. It's a simple little.
So we gotta add that.
Yeah, we definitely do. Yeah, don't forget the hands. But do the neck for sure with the face, and we can keep going. We can talk forever on this stuff. So, any other great questions?
You have a
got
lot.
a lot.
Does
Okay.
it help with droopy eyelids?
Yes. Okay. Again, I kind of go back to the combination. I mean, I don't like to just treat the eyelids. If I'm going to just treat eyelids alone, I kind of go more into the Fraxel realm, which is a different device that I have because I probably have like 1,000 machines here. And it's one of our older machines, but it actually is still quite the workhorse. When you're using CO2, it looks better when you do the whole face. Like it's very important for us to do from the hairline all the way to all the edges into the neck, all the way that people see, because God forbid if you're this skin's looking better than this skin, it's like, oh, something's weird there, you know? So you really should probably say, if I'm going to do my eyelid, because your eyelids are part of your face in the treatment. So you do the whole thing, you know? And anybody who's getting eyelid issues is going to have mouth issues, is going to have this issues. So I think, you know, trying to segment them out too much is kind of tough on you. If you have a really problem with just the eyelids, we can also use Fraxel, which is, again, no downtime. And we just tighten the skin around here. I really do like the combination of really the Morpheus with the Cool Peel. And the reason is you can really get some really strong heat in here and really open the eyes up. And you can do it in this area where we start to get, and you know, I have the family strong nasolabial folds, and I can do it in here or my gels, and it starts tightening everything up. And we have some more aggressive settings than we even used to use that really contract the tissue tremendously. So eyelids, a lot of times, it's not just skin getting lax, it's actually the muscles are getting lax. So if you can kind of get it and hit it really hard, you can actually get almost a facelift look. So a lot of people, I think, if you could try to do some of these things and not necessarily have to have a facelift, you know, even if you have a facelift, you're going to have to come back and do these things because, you know, when you have a facelift, sometimes the skin is still too thin looking and you have to build it up. You know, you use your things like your TNX, use your Skin Aid, use your devices that create more collagen build. So all of these are pushing to build collagen and tightening.
Right. Love that.
Is it really painful even though you're numb? And if so, can you give a pain pill just in case?
You know, we have Pronox, we have pain medication here. Cool Pill, you don't need it. You really don't. It's just topical numbing. I have zero pain threshold, and this one does not hurt. So don't even be worried about that one. Morpheus has more pain, and I'm always totally honest about the pain because I don't want anybody surprised and go like, oh my gosh, what I get into. Morpheus, I usually, like a lot of times if somebody has a really low pain threshold, we use Pronox here. That's kind of the first strategy because it just clears through your system really quick. And we also have some drugs that we can have you take that clear really fast, so it really doesn't impair your mental state afterwards. So yeah, it's actually more things to kind of create less anxiety more than anything, because it's the anxiety that I think most people get.
Just make you feel relaxed.
It makes such a difference. I mean, I use Pronox for some of my people that really have a hard time with just injections.
Right.
We use Pronox, and it changes their whole injection. They're like, oh my gosh, this is the first time I've ever felt, you know, comfortable getting an injection, which you know, that's kind of sad.
It's about the experience. We
It
have to
is.
have a great experience.
Exactly.
And do you need to repeat this every year?
You know what? You have to repeat everything. And it's kind of like brushing your teeth. The day you stop brushing your teeth, they all kind of fall out. It's the same. And I wouldn't say you have to do it every year. You know, it depends on what's going on. If you're out in the sun a lot, you know, if you're really abusive to your body, if you're a tennis player, you probably have to do it every 6 months. If you are somebody who's in hibernation, like if you live up north, you know, I've never seen better skin than going to Chicago. These people, most amazing skin because I don't get any sunlight.
Right.
You know, so if you're really out there and you are in Florida, like, I mean, I look tan and I'm not out there other than in my car, in and out. So I'm getting this much color just by living in Florida. You know, you're gonna always get a lot of sun here. It just depends on what you're doing. I would say for the average person to be happy with it, I'd say in 9 months you do one. You know, you just kind of keep it up like that. You don't have to do the whole series again, but you're just keeping up with stuff and consistency and keeping up and supporting with skincare products. Consistency is always the key on this stuff.
100%.
So it lasts approximately 6 to 9 months.
You know, it's not that it lasts 6 to 9 months. It's really, the effects aren't going down. We're probably just kind of falling apart a little more and, you know, you're going and getting more damage. You know, if we put you in a sealed vacuum container for 6 months, you still may look fine, but it's just unrealistic.
I tell a lot of patients it gets you to a better baseline, and
That's a great way,
you know,
yeah.
and then I mean, you may come back a year from now and find that you have a little bit more sun damage or that you just want a little bit more of a cleanup. So it's not so much that it doesn't last, it's your body, right? So it requires some sort of maintenance, great skincare,
Yeah.
great skin aid, you know,
It does help.
skin aid.
It does help. You know, and I want you guys to know, the day that you do it and a little bit the next day, you may, you know, don't plan on going out. You're not going to dinner that night. Don't plan on like, oh, it's just a little summer. You know, you're not going to be going out. So just kind of scratch it off the list, but you're getting a big treatment and it's going to do better for you. Just understanding that, you know, sometimes people come in and they think it's going to be real fast. They're going to go do something else. And it's like, I wouldn't. I mean, even when I do injections, you don't want to work out right after because then you're going to bruise and swell worse.
And is it safe for thin and sensitive skin?
Yeah, I mean, if somebody's really delicate, then we may decrease it and we may have to do more, but in a lower setting. So if somebody has really delicate tissue, it's going to build the tissue up. You know, and those people, maybe we need to add a little Sculptra. If you add a little Sculptra to the party, it's going to grow more collagen. And all these things are synergistic.
I like that,
Yeah.
actually. We just get to customize the settings with this machine even more so
Yeah.
now. So the patients,
It's like one more way of making us look good.
right, yeah.
And I believe you touched on this, but I know you said it's best for treating brown spots. And then do you recommend a series of treatments?
No, okay, I'm not going to say that it's best at treating brown spots. I'm going to say that it's best at cleaning the slate of the tissue. If I really just have a couple brown spots, I might want to use just IPL, which is a laser that's hitting just the brown spot. Most people have tissue texture changes along with their brown spots, so it's kind of hitting both of those things. Sometimes getting rid of some of the red. You know, people who have a lot of the red blood vessels, and I'm pointing to the chin because this usually is where it is right here. Believe it or not, Morpheus is like one of my best treatments. So even if I'm using an IPL laser that's normally my treatment of choice for the blood vessels, sometimes it's almost a better result, not necessarily the most fun treatment. It's quite easier on you to do the IPL, but you actually get less red out of the tissue from the Morpheus because it's in there coagulating those little vessels. So it's kind of an interesting thing in that I know it's kind of hard to conceptualize what's this. They kind of are overlapping in some of their duties, which is okay because not every device is going to give you everything. You know, it's not going to be able to necessarily give you 100% of this or 100% of that. So when you kind of have things overlapping, it all brings it and makes it at a higher level.
And how does the CO2 peel compare to the European peel that we offer, as well as the Morpheus in terms of results? Is one better than the other?
You know, actually, I kind of just intertwine them. Like I said before, when we use European peel is a TCA peel that has a very minimal downtime to it. It like when and actually I was wanting to do one of these before I come down here because I was like to glow a little more, and I didn't get to do it. I was dying, but it gives you a lot more glow to the skin. It does even out the complexion more, so it's different. It's more of a chemical version of kind of what CO2 does, But that's why I kind of think the CO2 and the chemical peel together give you a more synergistic uplift.
I like that actually. I think usually say like, you know, we have one end of the spectrum and the other end of the spectrum. Some of these treatments fall in the middle. So for somebody that, you know, that's not really maybe ready for a laser, you want to try something first, you could start with the peel and then come back a week later.
Yeah.
Oh, you could start out with the TCA peel, come back a week later.
I mean, I think that the TCA peel, which is our European peel,
Yeah,
that one is probably more for somebody who has pretty nice normal skin, but they're anywhere from their 20s to their 40s, and then probably from the later 30s to the 50s. You know, maybe the peel or maybe the cool peel. You know, maybe the European peel, the cool peel. Then when you really start getting into your 40s, you're having tissue texture drag down, you know, you're getting the loss of collagen and you really need to build it up. So you need to do something more like a Morpheus to add in there. Like when you're young, unless you see a little bit of sag, and some people sag younger than others, you know, that's when you start really adding the radio frequency and into the mix of it all. You know, and these are the things that kind of will keep you together. I mean, if you could start in your age group now, I don't think you'll end up having a facelift.
Prevention is key.
Mm-hmm.
This patient's asking at 63, do you think the CO2 laser would be better for her around the mouth area?
Yes, I think you can do, again, two things. It goes back to, you probably need CO2 or cool peel. And you can do the cool peel and get CO2-like effect if you're doing a multiple of them. But I would tell you, more than likely, you probably need some lifting of the tissue too. So you're probably going to want to add, it's Virtue and Morpheus. And I say the word Morpheus, kind of like I use the word Botox for any neuromodular. I say Morpheus for any of the microneedling. Virtue is another device that we have that's a radio frequency that is actually excellent. And it's a little bit more gentle for the people that are a little bit more like pain intolerant. And it is, it's also going to give you that tightening effect, but they're just different. When I run super hard lifting, I kind of go more for the Morpheus. When I go for not so bad, or really delicate tissue, or somebody really pain intolerant, then I go more for the Virtue.
And does the cool peel work if you have rosacea?
Yes, it does. It cleans up that tissue.
Is it true that if you have a gut?
I don't know if you guys heard. She asked if it was okay to use in someone with rosacea. It definitely will help with the rosacea skin. It kind of smooths it out. One of the problems with rosacea is that you have a lot of bubbly looking skin, and it's actually the blood flow is so robust that it's kind of feeding the tissue, and you get like thickening of the tissue. So it's actually a great treatment because it smooths it out and it doesn't stir it up and make you have more rosacea.
Is it true that you have a gut imbalance and or hormone issues that if you do the CO2, will your skin just revert back to how it was?
If you have hormonal or gut problems, you need to get those treated. And this is not that obvious, but you should get them treated. And yes, I totally know what you're talking about. But it doesn't, I mean, you're not gonna immediately revert right back. Everybody's gonna revert back over time anyway. So you will still see results. It may not be as long lasting if you're not getting this other things treated. So yeah, and a menopausal person, nobody else in here is perimenopausal, but perimenopausal, you have to keep addressing those things. It's kind of like I have to take vitamins, I have to eat right, I have to do all this stuff. And you really do have to address if you have some problems.
Do you recommend using the Elastin skincare nectar prior and after the CO2 laser?
Love. Yeah, I love the nectar. It just has been an amazing product line in that it really cleans the tissue out ahead of time.
I always, coming from New York, I used to do a ton of laser up there. We didn't have the cool peel. We had more of one of those older CO2, but we would make our patients pre and post treat, and we were using the nectar.
Yeah, and we use it also
all the
with
time.
the,
and we use it here too.
yeah, with the microneedling too.
Yeah.
You're gonna use all of them.
It's perfect.
Yeah.
You need to pre-treat and post-treat. It's so important. You can't.
It just helps you heal, and
Yes.
it's the same with the carboxyl therapy mask. It helps you heal, and anything that kind of gives you the leg up. I mean, you can minimize it, but you just don't have quite a great response. That's all. It's how as long as you're using the right tools, you'll get there.
And is the CO2 laser or the Morpheus better for patients with thin skin?
So the question is a CO2 or Morpheus better for a patient with thin skin? Honestly, they're synergistic. I mean, they only complement each other. And it kind of depends. Age is age. It just has so many manifestations. It's the thinning of the skin. It's the dropping. And those are really two different things. Everybody who knows me with fillers, I'm always about like, how do we get the face up? Because this is the dumping ground of age. So the more you have laxity or dropping of the tissue, the more you have to go to lifting, which tends to be more the Morpheus type of procedure. If it's just crepey skin, crepey, then I'll probably add Sculptra and I'll add the CO2, which is the cool peel.
I think that's why the consultation is so important, and taking the photos and looking at them together is so important, because this sometimes is like a multifactorial or multi-pronged approach.
We don't have the magic wand. We just have a lot of different wands.
We have to come up with a treatment plan that works well for you and for you as the patient. And sometimes it's okay, let's do Sculptra first, come back, and then, like a week later, or do the Sculptra that day, and then do, the Morpheus. It's just different, it's different.
I mean, we didn't have a lot of these things in the past. And I think that's what's so exciting is the lack of downtime, the ease of the procedure, things that take 20 minutes to do, meaning like some injections. The Morpheus time-wise, you're probably going to be in the office. Plan on being in the office 2 hours. That way we numb you properly. If you come in kind of numb for the cool peel, you probably are going to be here 45 minutes max. We can get that done very quickly. So, trying to think of your lifestyle, and, we're trying to meet people who have busy lives. I know you got things to do other than be in my office, even though we love having you.
What's the difference between the CO2 cool peel and the Pico Fraxel laser?
They're just different devices. The whole push of all these devices are really about heating the tissue. And again, this is the brand newest machine on the floor right now. This is the one we have. It's like beyond. Now the Pico is a little bit more of a combination, more like the older CO2 that we had. It's a more of a burning device. You might have a little more problems. You're not going to necessarily get to the darker skin tones with those. Right. So it's just a little bit more like my older machines. Right. And I don't mean it as bad. There are, in good hands, a lot of things happen.
A bit of a more pointed question. We have a patient coming in for her third Morpheus treatment, and she has 3 weeks between, and she wanted to make sure that she'd be okay as she's traveling, if she needs to do anything extra to aid healing. So just really about the timing of healing after Morpheus.
I think as long as you really give yourself like 48 hours to be safe. When you're having a Morpheus treatment, I would say Morpheus a little more than Virtue. You have about, give yourself a 2-day window, because it may not look like something like red, white, like that. Every so often somebody gets a little more sensitive, but you kind of swell a little. So you might have a little bit of swelling if you're traveling. It's like the first 24 hours, you have little holes in the skin. Right. That's when you have to just like really relax and not be where you're sweating, going to the gym, no makeup, things like that. But, by day 2, you're just more swelling. Always with anything we do. The first day, everything looks great. Day 2, maybe within 24 hours is when you swell. 48 hours, you're kind of maxing out the swell, and then you start coming off the swell. So the traditional any surgery or any devices we use in here, that's the normal.
This patient will only be visiting Florida for a week or 2. Will one treatment do anything for her?
Yeah, absolutely. I know people are kind of afraid to do a single treatment. Now, if they want, we can do a little. She's saying that I don't know if everybody heard the question, is they can only do a very limited amount of treatment because of their time in Florida. And one treatment does make a difference. Now, if we could get them a little more aggressive, if they allow us to, we can be super aggressive with it and really push a lot into one treatment. And, again, I think, what Christina said is we really have to have a consultation to make sure it's appropriate, number 1. And 2, if this is going to fit their needs and their lifestyle and everything.
And how long should they wait after getting alt therapy before doing one of these treatments?
Alt therapy is a fantastic procedure that, I think it saw its highlight probably about 3 or 4 years ago. Inherently, I think the bigger issues is that you get a lot of kind of fat loss in the face, usually along the jawline. So some people kind of have a hard time with it. It was a great device. We still have it. I like it more under the neck, under the chin, where we have a little extra gobble. I call it the turkey gobbler guy here. Yes. So to me, it's best used here. in here, I can use the forehead, and it's actually my staff are doing it, but it's the depth of the treatment that are important to create what you want. I mean, you don't see the results for that for probably about a month and a half, truly.
Right.
So it's just a different way of causing energy and no downtime. And it's still, I love it because you don't have downtime with it. I mean, I tend to get very swollen from it afterwards, but then I look like I had a facelift for a while, probably about 9 months. I look absolutely fantastic with it. But I think, I'm always concerned because I end up losing too much along my jawline, and we're always trying to rebuild the jawline. So it's kind of counteractive a little bit on that sometimes.
Again, I think I love when patients come in and we talk about why one is better than the other. And one of the things with L-therapy, like you were asking the question, I think that if you did L-therapy, to me, it's what were you doing it for? If you're doing that and then you're talking about doing the cool peel, it's, to me, different. If you're looking for,
you can do those together.
You can do them together.
Yeah, you can have them on the same day.
Yeah, exactly. So it's really something that you have to. No, but it's really something you have to see, because you may be able to do both of them and benefit from both of them. So again, I think it's great that we can do these lasers. And as again, your question, as you were answering the question, I'm saying to myself, for us, it's so simple to explain because we know this is why you use this, this is why you use this.
Yeah.
And it's because, you've been doing this for such a long time. You're so well educated on this. You teach, and you've taught me, and this is something that we do all the time, but it's important to go to a provider that knows why you're a candidate for certain machines.
Like L-therapy, like she's talking about, like L-therapy, you can go pretty superficial.
Yeah.
There are some settings or some device hand pieces that we can use. The problem I find is I think they're pretty uncomfortable for the more superficial hand piece, and I think it marks the skin too long, where I can do a full peel, get less downtime, and have a fantastic result all in one swoop, and not have downtime. So it's treating that really high level, which is the harder. I mean, I find the crepey harder to treat than actually sometimes the sag, because I can lift, I can do threads, I can do other things to get the sag up, but that crepey stuff that starts coming, that's hard to treat otherwise.
So how close together do you do the cool peel if you purchase a package of 3? And again, they're asking how long does it last, if you could cover that again.
Okay, so the question is what's the timing, space, and how long does it last? On a normal face, nothing totally drastic, usually you normally do 3-4 weeks apart, and you are okay for anywhere from 6 months to a year and a half. And that means everybody's so variable and you don't know. And it's also, how picky are you? I'm like crazy picky. She is too, actually. I'm going to want to do one in 4 months, but I may or may not,
Yeah.
But it's something you could do if you wanted to,
right.
Or you can say, hey, I know I'm pretty good with this. And so the average is going to be like anything, probably 9 months to a year for most people. They may just do a single. That doesn't mean they have to do a whole series again. I mean, I would buy the series package again because you're going to keep doing them, and it's cheaper that way. If you're going to keep doing it, that's the way to buy them because it's less expensive for you. And believe it or not, we are always trying to figure out how to make this less expensive for you at the end of the day.
What's the difference between Morpheus and threads?
Wow, big difference on that one. The question is, what's the difference between Morpheus and threads? Okay, so we are very pro threads. Threads are PDO, which is just a type of suture material that has little barbs or hooks on them. It almost looks like blue fishing line. I know it sounds so basic, but it's what it is. And we place them with cannulas, so there's not a lot of trauma to the tissue. But when we place them and we pull out our little cannula, it actually just lifts the tissue up. And it has about a longevity that you're happy for max 6 months. I would say that's the good and the bad, but you kind of combine things together. So it's actually almost like a type of filler in my mind is the threads versus the energy that you're getting from the Morpheus is what's creating the collagen to build, and it's a more of a diffuse pattern. So like the threads, once you do once and you get like that facelift look, it's kind of like, was it endorphins? So great. It's like, oh my gosh, okay, I just got a facelift. Exactly. You are cooked, literally.
Yeah, literally.
That's a good one. We're cracking ourselves up here. So anyway, so yeah, it really is an amazing procedure, but the longevity is its biggest issue. That's why I tend to use, and Christina does too, we use Sculptor with it to kind of hold it in place longer because we're trying to add more collagen build. We're trying to build your collagen. That's kind of what we do for a living, is we build your collagen, whether it's devices, fillers, fillers that create collagen, like the Sculptra. They're biostimulatory. Radius is a biostimulatory product. The hyaluronic acids aren't, but we don't always want certain looks in certain parts of the face. Everything has its great spot, and then it has its things that it doesn't do so good for. That's where our years of experience start coming in and saying, this is not going to work for you. Don't waste your money.
Right.
Like me, I'm not a PRP person. I think it's a waste of your money. There's people that swear by it. I've never seen it work well, so I would never say come in and do PRP. To me, it's just nonsense.
I think so. I thought about a consult that I was doing with a patient, and sometimes patients will come in and they think like, okay, I just want to do Morpheus or I just want to do filler. For instance, we tell you, I think you would be a great candidate for threads, but meanwhile, you were thinking about doing Morpheus, or you are thinking about doing threads, but we recommend Morpheus, for instance, and then right. So there are certain areas that we just can't physically put threads in,
right.
And so we may say, you're a great candidate for threads because we're going to lift you, but if this is bothering you, like here, I'm touching over here, this is why Morpheus is great, because you have textural issues, and threads are just not going to fix certain textural issues. Yeah. Right. So this is why it's important to understand that there's many things that we can do. It's not just a one treatment option. Sometimes we have to layer them.
Yeah, and and it is a good and bad. Dr. Google comes in and says you got to do this, and there's so many different ways of going about it, and it's really what your issues are what are important. And it is always interesting, especially a new patient. They come in and they're like, this is what I'm going to do, and I'm like, not a good idea.
Yeah.
But once they are educated, and that's the key. Is there's no way. There's just no way that somebody could put their own treatment plan together unless they've been doing this for years. Like, I wouldn't expect to go and do some GI stuff that I don't know what the heck is going on with it. I can't put a treatment plan together. If I had IBS, I don't know what to do.
Yeah.
But that's why you go to places that are reputable and that have certified doctors and their PAs are been credentialed. You go to places because this is your health, this is your face, this is your reflection to the world of who you are, and you just want to feel good at the end of the day and safe and know that we're going to be taken care of, because that's what's in our heart anyway.
Yeah. Can you use any type of makeup or moisturizer the day after a pool peel?
You know what? If you a little bit later, yes, I do, and you don't want to put the more like we do have special products that you're going to use. I'm just going to put it that way because I don't want you just putting on full camera makeup the next day. But it's almost more so for the Morpheus, because the Morpheus is putting little holes in the tissue, the surface of the skin getting a little like denuded or what's the better word? Because I'm going too scientific here. When you're scraping by heating, exfoliating in a way, but with heat, the surface of the tissue, it's a little bit more generous. It's actually the Morpheus type is a little bit more of a problem because it's putting deeper holes into the tissue. So by the next day, I'm usually putting a little bit of sunscreen makeup on, but light, nothing aggressive. If anything, I'm going to go towards more things that are a little oilier, and we have things for you to use. Things that are more hydrating or more sealing of the tissue. Like, people know Aquaphor. We actually have Elastin. It's an amazing balm that you put on and it helps you heal faster. And it's a little greasy feeling. So it's almost like it feels Vaseline-y. And that's more what you want to use the next day. But you look fine. You're just, if anything, you kind of swell. I think people swell around the eyes. They get the little puffies around the eyes. Usually you get a little joust if you're going to swell anywhere. Those are the typical places, or if you sleep on a side, you'll swell more on that one side.
Now, there's many product lines available for skincare, but is there one that that Dr. Tommy would really recommend?
Wow. I think there are some fantastic skincare lines. I mean, we use medical grade products, and the force of my thought when I'm bringing out a product for the office is this something that is more medical and has some science behind it? Number one, it has to have science behind it. It really has to be something that changes the skin. And I would say my absolute favorite is actually a couple of them, but it's really Skin Medica's TNS. It's the growth factors with the antioxidants. It's the double pump. Everybody's heard about it if they've seen me. That one I think is a standalone. You could use it twice a day for the rest of your life until the other one comes out because they do upgrade every so often. But I think that's the one that really tells the cells to start growing collagen. So it's more like specific products within skincare lines. My other one is Elastin has the most amazing neck cream I have come across at this point. Yes. And I think these are great for me. And I think that the science is behind them. I have other products that have great science. Like a lot of the SkinCeutical products are also really good, especially for those people that are super sensitive. SkinCeuticals is kind of the direction we're going to push them. Sometimes they get too irritated from some of these other things. So that might be the direction we start with. If somebody has pigmentary problems, I might use Obagi or I might use one of the new products, Aspera. So it kind of depends on your needs. One skincare line, unfortunately, it's kind of like asking me for one filler, one device. It's not going to happen.
Right? And
is there anything you think is different?
I honestly, as you were answering, in my mind, I'm saying to myself, skincare, yeah, check, but also skincare is the foundation.
Yeah, sunscreen.
Sunscreen.
Oh, Elastin sunscreen.
Yeah,
my
that's
favorite.
the best.
Yeah,
that's
makeup plus.
Every time you wear it, what do I say to you? I'm like,
what
do you have on?
I know.
Like, your skin glows.
I went to
Yeah, and she's like, no, it's the Elastin sunscreen because it has a tint that would be great to use. It's different. Every company has a great product for something. If you are somebody like myself, I go through these phases. I want quick and easy. After I had my son who has time to use all the steps, there's something that comes to mind for one-stop shop versus like now I love to layer. I love my moisturizer, I love my eye cream, I love my serums, I love all of them. So, every company has a great product. It's like you said, they're different. You use them for different things, so I agree with you.
Yeah.
What do you recommend for bad acne scars on the face?
Oh, that was a great question.
Yeah. Oh, go ahead. What do you do for bad acne scars?
No, I actually was going to say, so we need to discuss the cool peel for acne scars and also morphia for it.
That's the treatment choice right there. And it makes a huge difference.
Huge difference.
Now, we are actually at well over an hour, you guys, and there's still a lot of you on there. We'll keep answering if you guys want to stay on there.
We still have quite a few.
Yeah, we're happy to answer. Thank you so much for staying with us. Our chatter here. I know. Okay, so acne scarring. Okay, a sad discussion that I have every time I see somebody initially for acne scars is you do not lose the scars. The scars are forever. You have to. So what I would do is exactly what Christina said. Is I use the full peel. I did CO2 in the bath and Morpheus, and it's things that are going to build collagen. Ooh, imagine. But the other thing that we can do internally of the skin is actually use a little bit of Sculptra because it also builds collagen in it. So you're thinking of you have a piece of skin and then it dips down and makes a scar and then it keeps going. So that little depression is something that you're trying to lift up. The more everything's about why do I have like 6 lights on me is because I need a light reflection. It's how light hits the tissue is how we see the brilliance of tissue, and that's what we want to see. So when there's a lot of light hitting the skin and it's all nice and smooth, it has a certain appeal to our brain. When you have acne scars and you see those little pits or chickenpox scars, and it catches in those little shadows or catches in those little holes, it's making shadows and it's interrupting our eye. Our eye does not like to get interrupted. So that's why we crank up the lights when we do the camera. That's why we try to smooth the tissue out by Morpheus, Cool Peel, Sculptra from underneath it, Skin Aid as a drink. There's and skincare, and just always working on keeping everything. And I go like this because I want everything smooth. That's how light reflects off the tissue.
Someone in the late 60s, do you prefer Morpheus or threads?
Both.
Yeah.
Okay. The question is, if you're 60s, do you want to go Morpheus or do you want to go threads? It just depends on the patient, honestly. And I would end up using Morpheus and threads.
Yes.
And again, I go back to you kind of need a little bit of each to get there.
Mm-hmm.
And when I say threads, I usually say it with Sculptra. I mean, everybody who knows me, they know I put tons up here because this is what lives down here. So I use Sculptra up here, threads up here, a little bit of Sculptra in the face, and then I would send them to the rest of my staff who does the Morpheus. And it makes thicker tissue, it tightens. I mean, there's a certain amount down here that isn't going to be lifted. We can shrink a little bit with kind of like just this bottom little piece down here, and then you tighten it as much as you can, and you want to build the tissue as thick as you can.
If you have inactive thyroid eye disease, could a laser trigger a response?
Wow. I would definitely, if you have an active thyroid eye disease, you really need to see your ophthalmologist to get clearance before you do any of these. It's really going to be up to them. You know, we do shield your eyes when we're doing it, but you know, it's not so much the light with the laser. It's actually more, you know, when somebody has an autoimmune disease, you do have to be much more careful. You have to realize that you could possibly trigger. It's like with MS. You know, anything that's a little autoimmune, you have to make sure that the body is not going to trigger a response.
I think I would just
You want to get cleared. You have to get cleared first. But I mean, it's the eyes are covered, so it's not, the light is not hitting the eye directly. Now, if we're treating around the eye, we're covering the eye, and we're also pulling the tissue up. We're never getting below the bone. Right. So we, you know, when you're old, you can pull the skin all the way up if you want to. So we can actually pull skin pretty high and away from where we want to treat it, and treat it away from actually where it lies normally.
Is Morpheus better than injections? Fillers tend to metabolize, and that shortens the duration of the enhancement. So Morpheus extended.
Good question. You know what? There's no studies on this. Okay, I don't know if you heard it. You want to repeat the question?
So basically, the question was, you know, fillers metabolize. Is, you know, they break down, they don't last forever. Is there a way that the Morpheus, I think I heard it right, that the Morpheus can extend, or is there a way to extend the Morpheus treatment?
I honestly, there's really no studies on that. So, I mean, what would I think is going to happen? I think they both are going to go down about the same rate, because what the Morpheus is doing is building collagen, and so if there's natural degradation of collagen with age, and there's environmental getting irradiated every day, that people go play golf, they play tennis, whatever brings the collagen down is going to do it, whether it's a Morpheus getting it, or if it's getting it done by some sort of filler activity. So unfortunately, if somebody would put some money into the research on that, I mean, it would be really interesting to do a study on it, but I don't think that we really have a true answer on that one.
I think it goes back to foundation. I always kind of explain, like, if you build a house, you're not just going to build it from grass, right? You need a solid foundation. So if you're doing the Morpheus, if you're doing fillers, how do you create longevity? That's why we speak so highly about using proper skincare, using, you know, drinking the skinny. Our cells break down, right? You know, and we could talk about the whole science behind it, but if we can, you know, give our bodies the things that we need to enhance it, why wouldn't you? So it's like, you know, why would you put yourself and do all these treatments without really having something to make them last even better? And that's why we have that.
Yeah, I mean, it is like people who work out a lot do degrade quicker, and it's their metabolism set up. You know, so somebody who's like a major, you know, physical person, they're gonna have to be in the office more often. You know, somebody who's more sedentary, things just aren't moving as quick.
What do you suggest for super sensitive skin?
For I don't know if we're gonna super sensitive skin. I mean, there's a lot. Like, you can do the full peel. You can do skincare products. You can do fillers. You can do hydrofacial. Actually, this new cool the CO2 lift, which is like what you're gonna use for down below, is very hydrating, and the European peel. Yeah. So there are some really gentle things that don't have really strong reactions to it, but they give you changes, and you know, that's what we're looking for, is a change.
And if you get fever blisters easily, do you need to take an antiviral before Morpheus?
Yeah, we do. We have antiviral here, so if you need it, we have it for you already. I mean, if you really get that, I would pre-treat yourself anyway. Right. You know, if it's the mouth, the fever blisters, you know, and okay, that makes two different discussions here. If you have oral, fever blisters, you can pre-treat with 2 grams in the morning, 2 at night. It's almost like you had it. I don't know if you really need that much. You can probably just take 1 gram ahead of time. We normally give half a gram when people come in and have history. But if you're somebody who's super paranoid, it's not going to hurt you to take that drug. It's a very safe drug. So if you're taking 4 grams in one day, you're still not doing anything bad to your body unless you have serious kidney illness, which you probably won't be doing this stuff anyway. So you're fine. If you have vaginal herpes, you definitely need to let us know also if we're going to be doing any of these radio frequency devices, because we also want to pre-treat you. The dosage is different for that. Right. And you definitely just let us know, and we'll guide you in the right direction, and we'll get you treated. Make sure that you're not going to have an outbreak.
And if somebody's flying out that same day, they have Morpheus and then fly out that night?
Yeah, but you just can't put makeup on. You know, I don't know about you, but I kind of put makeup on when I fly. I don't know. I'm a little paranoid.
Yeah, I was just gonna say,
too natural.
If you're okay with walking around in your face, you know, having maybe a little not having makeup on, and walking around maybe with
you can. I would give yourself, like, if you could. I mean, I certainly, who knows? Let me think if I've ever done that, because that would be something that might.
I don't know. I'm not like, I don't know.
I usually take it easy. Then you know what? I mean, it's a little, honestly, it's a little uncomfortable. You get a little stressed out with the treatment, so you need to relax afterwards. You know, just being kind of traumatized a little. And I'm not saying it's a horrible treatment or anything, because it's not, but it is enough of a discomfort that you do want to be a little bit relaxed afterwards. You know, you don't want to be definitely not going to do anything that you're going to have to look for your top best. You really need to have your makeup on for sure.
And also, if you like have to be out at a certain time, you know, we said give yourself 2 hours, but sometimes, you know, you may need to use the restroom, or you may be hungry, you want to have a snack here, have a cup of coffee. You know, like time, you know, if you are on a strict time frame, you don't want to stress yourself out and have to rush. I think for me, like, I mean, if I'm a little swollen and I have a little redness, I don't know if that would bother me so much, but that may bother some people.
Yeah.
So
yeah, I mean, you might be a little like irritated from it, but again, it's by the next day you're pretty okay.
Just by the next day.
Yeah. Please.
Can you quickly repeat your favorite elastin neck cream for the audience?
It's the elastin neck.
It's a elastin
neck cream.
Elastin firming neck cream. And I do like their hydrogen sunscreen.
And moving on to the female treatment.
Yes.
Is there any pain with intercourse after? Does it help with pain after? Things along those lines?
You have to wait 48 hours after the procedure before you can do anything
For the beat.
That's the contracting.
I'm sure people will not follow that,
but I mean,
this is what we recommend.
That's what we recommend.
It's actually kind of it's a brand new treatment, so we are kind of feeling this out. I will tell you, not the microneedling, but the other one, it tends to be a very popular event after the treatment. I'm just going to say it that way, and there's nothing wrong with it. It's fine if you want to use it, and definitely when you're using it with that V-lift, I think things will be pretty good.
Honestly, I think. Does it help? What was that? What was the second half of the question? Does it help with discomfort?
With discomfort with intercourse.
Yes.
It will. Yes. All of these are to help you have a better sex life, basically.
Yes. I mean, just because again, it's lubricating the area, it's tightening the tissue.
This is more muscular contraction is what the V-tone does. The Forma V is the very gentle. It kind of looks like it looks like tampon.
Yeah.
And it's actually inserted and it's heated and it has the radio frequency. And this is actually stimulating blood flow, but it's also helping hydrate. Like it's making the newer tissue just like we would do it externally on the skin. If we do the ones with the needles, I would tell you you're going to probably take about 3 days break at least, and then you could probably do normal sexual activity.
So the V-tone helps with like incontinence, tightening, whereas the other device that we're talking about is going to help tissue.
Yeah, tissue regrow. You know, if you're having like painful like sandpaper feeling sex, you know, it's hurt. If things are, as we get older, it actually the vagina actually shrinks, so it gets smaller, and it's atrophying, and so not just atrophying, but actually the whole vagina gets smaller. So it actually starts getting a little bit more stretchable. And then when you start adding the B-tone in, it helps even more.
It helps externally as well, right?
Yeah. And that's a big concern. People want to look good down there.
Does it help?
No, I will tell you that is probably more surgical. Yeah, if you're having a real prolapse, you're better off going to the OBGYN. Yeah, this is for pretty much normal, no seriously surgical needing devices at this point.
Yeah, definitely not for prolapse.
No.
What do you think of elastin's new 8-day immerse serum? Is it supposed to be the same as Skin Medic's TNS?
No, they're not the same product at all. I have used the new Elastin HA, and it's very lovely. I haven't used it long enough that I can say this is something I would replace another one yet at this point. But it is something that, just being Elastin, actually, there's so much good data and science behind it that I'm sure that the science is going to be behind it. But I kind of want to see a little more time behind it before I could say, yes, this is going to replace that. At this point, I don't find anything really replacing TNS.
This is like apples, oranges, skincare products, but like I'm layering these. So I'm using the TNS with this new HA. It's hyaluronic acid. It's
really different. TNS is like growth factors and antioxidants.
This is like, that's
hyaluronic acid
anti-aging.
is pumping the tissue up more.
So you need both.
Yeah, sorry. I know. It gets a little long in the morning.
Yeah.
Put it on.
This 69-year-old patient heard about Elevate, that heard that it lasts for many years. Can you talk about that a little?
I'm sorry, how old?
69.
Okay, a 69-year-old looking at My Elevate. My Elevate is really cool, okay? It is a permanent suture. So basically what the procedure is it's a numbing of the lower face, and particularly the neck. Part of it is actually surgically cutting the bands. I know that sounds gross, but it actually is really simple. But putting a surgical thread that is permanent in there. Now, the bigger issue is at 69, there's usually too much laxity. I probably would say, without even looking at you, if you have really tight jawline and just nothing really hanging down, yeah, it may be something fantastic. But at 69, usually we have a little bit too much drop. And sometimes you're underwhelmed with the results. And almost always with My Elevate, I will also use Face Tight, which is the big brother of Morpheus. It's actually the internal version of Morpheus, and I do those together. But still, I think sometimes it's almost better to go get a neck lift or face lift at that age. And I don't mean to be, without seeing you, I really wouldn't know. But just knowing that that age, sometimes it's just too much loose skin, and you really have to get some of the skin removed. So I wouldn't want you, I mean, if you came in, I'd probably end up sending you to somebody who does more excisional changes for you. Okay, so we had a very fun, long day. We enjoyed the heck out of it. I hope you guys did, but we can talk on this stuff like, I'd be here tomorrow morning if I had to be, because I love it so much, as I know Christina does too.
Absolutely.
So don't forget, everybody, 18% off on products, and we did say it's the foundation, so please take advantage of it because 18% doesn't come around too often. $180 off any of our packages that are worth more than $3,000 for pretty much anything in the office.
So nice.
It is. And with everybody that's been on tonight, we are going to do the giveaway drawings. We're just going to pull them out, and hopefully you're going to be one of the lucky winners of the 4 pool peels. We're going to be doing the package of 3 Morpheus V, which is the downstairs Morpheus, and it's the little bit more aggressive treatment. We're going to have the V-tone, 4 V-tone treatments that Christina has kind of already talked about that she's had done. We're going to do the Lift V at home, and that is for the downstairs the gel pack that is definitely a help hydrating and helping with your sexual health. Then we also have the face version, which is called the Lift Pro, and it's the face mask that really helps hydrate the tissue, and it kind of helps with some of the numbing, but it really hydrates the tissue, and you look very soft and glowy after you get done with it.
Love it.
So thank you so much for joining us. Next year, you gotta come to the office because we are gonna have it as long as there's no more COVID strains that happen. If you don't know, we have optional masks in the office. I do still wear a mask when I'm with you in the office because I'm in your face and I don't want anything I don't want anything to happen to anybody. So please, please, please take advantage of all the great things that we have to offer. And we're like always excited to see you guys, and we couldn't do it without you. Thank you so much for joining us.
Thank you, everyone.
Right.
Have a great night.
Good night.
Take care.
Bye-bye. Okay, behind the scenes, little Miss Allie joining us for the 18th year anniversary.
Yes.
Oh, mwah, mwah, mwah. Big kisses to everybody. Thank you so much for joining us. She had to be seen though. Come on.
Yeah.
We love our Allie. Look at this cute jacket that Linda Moore had made. So cute.
Say we'll do the prizes.
We're going to do the prizes on Instagram this week. So just stay tuned to Instagram, and we also will put it on Facebook. So we will
And
do
email.
them. We're excited to have them.
Yay.
Any other goodies?
Look, everyone's ready.
Yeah, everybody sees my
Thank you so
Allie.
much.
Yeah, sorry. No. She's swimming now.
Yeah.
She's going to town.
Oh, look at her little jacket. The
I know.
pins.
This is like the best jacket ever. Linda Moore, if you want to get one, Linda had it made. She has a matching one. I think we're all going to get one. Adorable. No. But thank you for joining us.
Alrighty.